So we're moving now to software, and we're focusing, so this is a software that I've been working on for the last 5 years. And we actually have a strong team of programmers and statisticians who have been working on this project. But actually the major thing that we have that I'm pretty proud of is that we spent a lot of time listening to the voice of customers on this software and also getting inputs from clinicians all over the world about this software. And we're right now working on version 2.0, which we launched version 1.0 in 2011. And it's a continual improvement. And so any feedback we get from you guys on how to improve this software are always opened. So why did we start on this software? The reason we started on this software is because from our surveys, we found that it typically takes, on average, about 60 business days for validation and verification of a molecular diagnostic assay. And from this survey, we actually see that it actually spans a wide range. Some simple molecular diagnostic assays can take about a month. Some more complex oncology multiplex assays can take over 12 months. And so we were looking at seeing if we could develop a software that could streamline its process. And what we've seen in version 1.0, and we have demonstrated in multiple labs, and a lot of labs have come back to us showing that we can actually reduce the protocol creation and even the report creation down to 2 days total. And this actually has happened. It does not include, of course, running the studies and collecting the materials, but we are able to streamline some of the more tedious processes. So what is it? So version 2.0, EZQC, it's a web-based software. It's very similar to version 1.0. But we listened to the customers. In version 1.0, we only supported quantitative infectious disease molecular assays. So that's like HIV, HCV, transplant viruses. But a lot of customers came back to us, what about multiplex? What about qualitative? So we implemented all of those features into this new version. We also opened up a new functionality. There's a new functionality. It's a networking, social networking functionality in the software, very similar to Facebook, LinkedIn. If we don't have time to go into this, but this is a very exciting portion of the software that we're very interested in. It allows you to share protocols, share protocols, guidelines with other labs. And also, in version 1, it linked to our quality control materials. So we're Life Technology, we provide quality control materials. But a lot of labs questioned us about this. They said, we have our own lab-developed controls. We also have competitor controls. We want to combine all those controls together and still use your software. So we opened up the software to allow that. And it's actually very, very cool now. So we can actually create dilutions and preparations from your homebrew materials as well as our materials. And again, it still supports implementation of molecular diagnostic assays. And also the new feature is that it actually has QC monitoring and peer comparison. So when we just created a prototype of this software just a couple days ago, and so we are hoping to launch the software around Q4, but we were able to get from Quidel their prototype HSV 1 and 2 and EZQC assay. So we had it for a couple of days, and so we were actually able to do some studies with this assay. So before we go into that, the software takes a couple inputs from the lab or from the clinician. And so the customer has to define the personnel, define the reagents, define the analytes, and define the instruments. Why? Because after that, it creates a repository, a database of all these information. So once you log in, you have all this information again. Once you define that environment, you then execute your study. So whether that's a validation, a verification study, a calibration study, a QC monitoring study, you choose a study, you set your acceptance criteria, you select your guidelines, you input your reagent lots, and what you get from those inputs is a complete protocol. And so this complete protocol encompasses data entry forms, plate layouts. You take this protocol, you execute the protocol, you get your data, you enter your results into the software, and immediately the software analyzes the data and produces statistical analysis and a preliminary report. You approve the report, and your final report is generated with a pass-fail summary table. I'm going to go over this entire workflow again one more time, step by step, not this fast. But we're going to use it using Quidel HSV 1 and 2 of EZQC assay as an example. The reason we use this assay as an example is because we actually currently have an in-house HSV assay that we use for research and development for release testing, for stability testing. It actually has an extremely terrible limit of detection, and so we were actually looking for alternative assays. And so we actually we were talking to Kaidel, and they said they had this assay, and it is a 5-minute heat-based lysis. It's used on our 7500 fast. It's approximately a 40-minute runtime, so it's really, really fast. Compared to our other assay, which is about 3.5 hours, it's a much faster assay for us. And so we used our Acrometrics HSV controls, as well as our multi-transplant controls, as well as various specimens that we had in our lab to validate this assay. So first thing we did is basically define the environment, define the lab, define the assay. So what we did here is we defined the Kaidel assay. And so in the software, we're able to input that it's a qualitative assay. It's a multiplex assay, so it has PCR targets to HSV 1, 2, VCV, and the process control. So we're all able to define that. Unfortunately, you can't see that very clearly in the slide. But afterwards, we can also define the instrumentations that we use. So after the definition, we're actually going to design a study. So what we want to do is we want to do a validation of this HSV portion of the Kaidel assay versus our lab-developed HSV assay. So we select our guidelines, and it's difficult to see, but in the guidelines, there's actually preset guidelines up here based on EU regulations and also US regulations. You can select those, and it basically will pre-populate number of replicates, number of days need to be run on the protocol. And with these text fields, you can easily change them to whatever regulations you might need. In case our interpretations of these guidelines and these white papers are incorrect, it can be changed completely by the lab to meet whatever their needs are. And so for this assay, we specifically looked at precision and the method comparison comparing against our in-house HSV assay. Again, we use these samples, so we define these 40 unique samples as well as our controls. So after defining these guidelines, a protocol is generated, and I just took quick screenshots of the protocol. This was actually a 9-page protocol because there's plate layouts for each day as well as dilution schemes. And so this is what you would see on the web. And basically, you can select certain areas and go to acceptance criteria, input reagent lots, and also enter your results. You also get a plate layout, and this plate layout can be changed and modified. It's a JavaScript, so you can drag and drop anywhere on your plate layout to change it to meet your needs. And finally, signature page at the end of the protocol. This actually, when you generate it, it's a word-based protocol, and so it can actually be easily modified to add a cover letter for your lab or anything to meet your needs. So, protocol is generated. Now, after the run, we can analyze the data. So, the software actually inputs data manually or actually uploads directly using a CSV file, especially from like the Applied Biosystem SDS file. What's cool about this is that immediately after you enter in the results, outliers are analyzed. So immediately outliers are flagged by a yellow square, and it actually can be, you can then choose whether you want to ignore or you want to accept the outlier. It's up to you. The software just flags outliers. And so these are lists of a couple of the statistics that are available. It's based on the guideline you use. You can run all these statistics. I won't go through all these statistics, but it's actually quite a number of statistics that would meet a lot of clinical requirements. And so specifically in this Kaidel assay, and specifically focusing on the HSVs, we did a method comparison. We ran 40 samples, 20 positives and 20 negatives. We assumed 20 positives and 20 negatives. And what we found was that actually 2 were detected negative in our in-house HSV assay, but positive on our Kaidel assay. We actually ran a third assay, a very sensitive assay, and we were actually able to detect that these negative samples that were detected on our in-house were actually less than 400 copies per ml. In addition, we did not have time, but I wanted to run a probit analysis on these assays, but this is something, a follow-up study I will do. We also did precision on these assays, and this is a qualitative assay. So we did precision based on a CT value, the cyclothreshold value, and we did within run precision 10 replicates over 1 plate, as well as over 3 days, 10 replicates. And we had very low standard deviation, so the precision of these assays are pretty tight. So these are statistics we did not run on the Kaidel, but these are a couple of other statistics that are available in the software. There's linearity, dynamic range, as well as probit analysis for 95% limited detection, as well as confidence intervals that the software will calculate for you. And finally, when you complete the study, a nice validation report is generated, summarizing all the data, summarizing all the raw data, and allows for signatures again in the software. So just checking time. A couple more minutes. I will talk about QC monitoring. This is just a couple slides. This is a new module of this software that we're adding on. And we added it on based on some of the customer requirements that we were hearing, that they wanted to have a software that also not only monitors within the lab QC, but also comparing to within peer groups. And so we modified the software and added this functionality. And we also combined this with actually a new control that we're launching, and it's a multi-transplant positive control for transplantation viruses. We actually have 7 different viruses in a 50 ml fill volume bulk that can be used to test as external run controls for all these transplantation assays. And so basically in this QC within lab, we create a Leibniz Jennings plot, and we can set control limits, 3 standard deviations or 2 standard deviations. This data can be parsed, can be looked at by operators, by instruments, exactly why we asked in the beginning of the software to input all these instrument and operator information, because at the end you can parse the data to look at the data in however way you want to. Also, you can look at the data within your lab compared to your peer group and see how your means line up. And so this is one of the graphs that's available in the peer comparison. There's actually a couple of other statistics that we're actually implementing now into the software. And finally, so to summarize, I'm hoping to show that this software can actually streamline a lot of these processes. We're following guidelines based on ISO 15189 and also as well CAP guidelines. We got some input from version 1.0 that the users, especially in Europe, want to have these protocols and reports in these country-specific languages. And so we're actually adding multi-language capabilities to the software so we can have these protocols and reports translated. And so in summary, again, it's a software that helps validation and verification, and now it also helps QC monitoring. It has validated statistical analysis, and it generates a final report. It's linked to our materials, but also has the flexibility to link to as many other materials as well as lab developed materials. And so in finality, I just wanted to thank a lot of people who worked on this software. We have also a lot of collaborators as well that are not even listed on this list that helped us with the software and provided us input. As we're launching version 2.0, we are already thinking about version 3 and version 4. And any input from the software, if anyone uses it, it's greatly appreciated, because that's how we're improving the software based on inputs from you guys. Thank you very much.